All right, folks, while you get seated, I'm going to introduce our distinguished keynote speaker today. My name is Deepak Ganesan. I'm a professor of computer science at UMass Amherst, and I'm also one of the leads of the Mass AI and Technology Center. And it's my great pleasure to introduce Sarah Lenz Locke. So Sarah is the Senior Vice President for Policy and Brain Health in AARP's Policy, Research, and International Affairs, where she helps position AARP as a thought leader addressing major issues facing older Americans. In fact, we were looking at the companies in AARP's incubation lab, and we realized several of those companies are actually represented as part of our collective as well, and we're working with them. So there's substantial synergy between what AARP is doing and what we are doing here. Sarah is also the executive director of the Global Council on Brain Health, an independent collaborative of experts created to provide trusted information on how adults can improve and maintain brain health as they age. So she had this recent article in Nature Aging in January this year, where she observed that an often overlooked benefit of brain health is what it can mean for the entire society when its older population is more cognitively resilient. So the positive effect that a mentally sharp workforce can bring to the larger economy. So with that, we are delighted to have Sarah here speaking on a very important topic, which is very relevant to us, which is on harnessing the power of AI to improve the quality of life for seniors and their caregivers. Thank you.
So I have no slides. Coming to a tech conference with no slides, using the old technology of index cards. But the new technology, because I like to hear myself speak, of an alarm that will alert me to when it's time for Q&A. So thank you. Good morning. Thank you very much, Professor Deepak, for that introduction. I'm very happy to be with all of you this morning at the inaugural A2 Collective National Symposium here in Baltimore. Happy International Women's Day. Thank you to the organizers for this conference, for Rose Lee and her associates for inviting me. It's terrific to be here with friends and colleagues working on these issues. And we're all working on improving the lives of older adults and their caregivers. Thank you to Diane Tai for suggesting me as a speaker. She is on the External Advisory Committee for the collaborative, and to NIA for funding and supporting the importance of the work all of you are doing. I want to give a couple of shout outs. Dr. Karlowicz, who was the moderator for the previous panel, is a founding member of our Global Council on Brain Health. And Esther O is here, who we've worked with on issues of delirium. I actually saw several of my ARP colleagues. There you are, Michael Hughes, and the National Council on Aging, NCOA, Jim Furman is here. So it's fantastic to be with all of you. There are many other people at ARP who are working on technology issues other than myself. In fact, my colleague Michael Phillips is working with the AI Caring Initiative funded by the National Science Foundation and told me to give a shout out to Elizabeth Minack. And Andy Miller, who directs the Age Tech Collaborative that you are mentioning, and their jobs are to facilitate and find markets and support markets for development of some of the solutions that you all are creating, because we want to assure that these technologies are out there to benefit older adults. So why the heck are you listening to me, somebody who sits in the policy and brain health shop at ARP, instead of these esteemed colleagues? Well, I think I'm here because I'm sharing some of the ideas that I care most about and that you actually care most about. And that is integrating the human values we all share. What can we do to harness what we all know is the enormous power of AI to help older adults and their caregivers? So I'm an English major. So I'm going to start with a line you all may be familiar with. These are the best of times. These are the worst of times. It was the age of wisdom. It was the age of foolishness. It was the spring of hope, and it was the winter of despair. You may recognize that as Dickens' the opening line in The Tale of Two Cities. What he was talking about was the French Revolution and the competition between Paris and London for the heart of Western civilization. It's a mix of positives and negatives that existed at that time, and that he was talking about the extreme contradictions. It was a time of extreme opposites, controversy, and like AI now, it could go either way. The proclamation of revolution for oppressed citizens turned out to be a spring of hope for some, but for the established political systems, it was the end of their power. That is exactly, I would say, where we are when we are talking about AI and its potential to improve the quality of life for adults and their caregivers. And we are at the precipice of deciding which way the story is going to go. It is up to you, each and every one of you in this audience, listening to Zoom in the room, to determine which way it's going to go for seniors. That's an enormous amount of power. You heard a lot about the ethics behind it, but it's not some abstract idea. In fact, it's completely within your control. I'm going to share a few stories, a few good stories and a few bad stories with you. So the first story that I'm going to share with you is an inspiring one. It comes out of the work of the University of Southern California's Center for Body Computing. The center has developed an AI-powered virtual coach named Ellie. It's designed to help older adults manage chronic conditions. It's an interactive avatar that engages patients through natural language and provides personalized coaching and support. One of the patients that Ellie has benefited is a 75-year-old man with hypertension and diabetes, and he has struggled with these conditions and had frequent hospitalizations due to all of them all this time in his previous life. But after working with Ellie for just 6 months, he was able to better manage his blood pressure and his blood sugar, and his hospitalizations decreased significantly. So let's contrast that with not such a good story. In 2018, a study published in the American Medical Association found that an AI algorithm was used to predict which patients would benefit from extra care. But the journal article found that it was biased against older adults. How could that be? The algorithm relied heavily on the number of chronic conditions a patient had, which tended to disadvantage older adults who were more likely to have multiple chronic conditions. And so they could not benefit from the extra care because of that bias. Another example, not so good. These robots that are being used in nursing homes, while these robots certainly can be helpful in assisting with tasks like medication management and mobility, what is that going to do to the human touch that people in these nursing homes need Is that going to substitute, and are we going to continue to shrink the numbers of people who are in the facility because now we have others who can, robots who can manage? So Irene told Chen, just in the previous panel, spoke about bias a little bit. A study in the journal JAMA Network found that machine learning algorithms trained by electronic health records were less accurate at predicting dementia in Black patients than in white patients. The researchers found that this was due to differences in access to healthcare to begin with and socioeconomic status. Because the algorithm was trained on data that was biased toward white patients, it was less accurate at predicting dementia in Black patients. Now, of course, we can't let that stand, right? So those are some of the bad stories, but let's go back to a good story. This is one that gives me a particularly good, heartwarming feeling. A team of research from the University of California, San Francisco, used AI to analyze brain scans and identify early signs of dementia in older adults. The researchers used deep learning algorithms to analyze the PET and MRI scans of the brain, looking for patterns of brain activity that are associated with early stage dementia. A woman, one of the patients who had participated in the study, was an 82-year-old. She had a history of memory problems, but somehow she couldn't get a diagnosis. It was an AI analysis that showed that she had a high risk of developing dementia in the very near future. And armed with this information, her doctors were able to start her on early interventions and treatments that could help her slow the progression of the disease. The woman's daughter, who was overjoyed at finally finding out what was going on, she said, "This study has given me hope that we can use AI to help detect the early signs of dementia and provide better care for loved ones as they age. So how is this going to go? What does this mean for all of you? I would tell you that it's up to you how it goes. You are the AI experts. You're already engaged in trying to develop technology that will accomplish these goals. How will you develop and design and deliver your solutions? Because along each step of the way, the choices that we talked about earlier this morning are going to determine these outcomes. Whether or not we live up to the enormous potential of AI to transform care, we know we desperately need it because we simply don't have enough caregivers to match the growing numbers of older adults. But you will decide whether or not it is more personalized, whether it is more effective, whether it is more efficient, and whether or not the people who need the access to it the most will get it. I have several questions that I want you to ask yourselves. Have you asked how the cultural, social, and emotional needs of different aging adults are going to be addressed by your solutions? Older adults are not a monolith. We talked about races, we've talked about genders right there. Conditions, they're incredibly complex. By the time that they reach their 60s, 70s, and 80s, they've lived a lifetime of very complicated factors that have turned them into the people they are. So how are you going to harness the power of AI if you haven't asked yourselves those questions? Are you building solutions that people can trust? Have you balanced the privacy concerns with the benefits of the technology you're developing? Have you designed a system that complements rather than competes with the human touch? Have you created something that older adults are actually going to feel comfortable using? Will you understand and incorporate the complex needs of aging adults, or will your solutions simply develop a one-size-fits-all approach that leaves out entire groups of people from accessing and benefiting your hard work and your technologies? I want to leave you with two final thoughts. In order for you to assure that your technologies and your solutions are accessible, are relevant, and are responsive to older adults, you have to engage those older adults in your design process. Like the panel of lived experience associated with the impact collaboratories and the practical things. If you're not talking to and designing with the older adults in mind, you are not going to be successful when you answer these questions. So one of the things that ARP has done is supporting an international prize and found the people who are living with dementia and their caregivers to become active judges in who wins those prizes. And then they're going to co-develop and co-design the solutions so that they're reacting and responding appropriately to the suggestions of these people. So if you're going to involve older adults in your design and development and your delivery, you can ensure yourself that it will be relevant and that it will be the best of times for AI, because you will be assuring that it will improve the lives of older adults and their caregivers. Remember that you are responsible for the way the future turns out, and you will decide whether or not it's the best of times or the worst of times. Thank you.
Thank you, Sarah. I think those 7 questions, I can see that being like the, one of the speakers had these 3 rules of robotics from Asimov, I think, in their slides. I can imagine a set of 7 questions that all of us have to explore and look at very carefully, and the participatory design idea. So I want to open up for questions. We have a fair bit of time, I think, and this is a thought-provoking talk, so please go ahead. We have a couple of runners, I believe, with the, correct? Do you know where the microphones?
I see somebody way up there.
Yes, I'll take your question, but I think we do need the microphone for the people farther down. So maybe I'll take a nearby question first until we get the microphones over the person over the back. I think the question was, yeah, go ahead.
You go ahead.
As I heard it, the question was, how can ARP help with customer testing and market feedback?
So one of the things that we, from just a fundamental philosophical perspective, talk about when we're developing solutions for older adults is nothing about us without us, right? The same kind of disability concept. And so we have 38 million members. It's harder to find necessarily the people who are willing to step forward, but we work with different advocacy groups and we have volunteers who are incredibly interested and invested in helping people deliver solutions that work for themselves. And so we put a call out to individuals to say, are you interested in developing these tech solutions? We had a list of 50 people. They could only use 4 in the judging panel in London in the work for the Longitude Prize. So we have people who are clamoring and see the need for this, and we would be delighted to work with. And that's one of the key things that we do at the Age Tech Collaborative, is try to engage in design thinking and design solution with the people in mind. And so I volunteer ARP and the work that we're doing to share and help you co-design.
I think let me just follow up on that. This question of participatory design, especially when it comes to older adults, but with MCI and with various stages, that's a bridge that is very difficult, because it's harder than doing it with a group of younger adults or even older adults without cognitive impairment. And I feel that's where a lot of the technology gets blocked in terms of the ability to engage these individuals in the participatory process.
Yeah, so it's a great question. I know that many people who are running clinical trials all the time struggle with those issues, but we always try to ask the person if they need or want their caregiver to participate with them when they have cognitive decline and all of the issues that are necessary. But typically you need 2 people to be involved in those kinds of discussions if you're talking about cognitive impairment, both also for length of time, because obviously the conditions change, and over time you need to have multiple backups sort of ready and willing to engage in the conversations, because if your project takes a while to develop, the person where you started with, they may need a caregiver to intervene at that stage. And so you kind of need to plan for that from the beginning.
Okay, we had a question on that, yes.
Okay, hi. My name is Sana Gaspard. I'm the CEO of a health tech company that's developing a solution. I'm up here.
Okay, great.
We waved before. So I'm developing a solution for chronic wound care management, which is a complication for older adults with dementia, diabetes, or any limited mobility. I first wanted to thank you and AARP for sponsoring competitions that support startups, because I just recently won one of your competitions.
Congratulations.
Thank you. And I'm looking forward to figuring how we can collaborate, which was an artifact of winning. My main question for you is 1 or 2 questions. So a lot of things that have come up in the meeting today was about having standards for design, not just on the algorithm, but the UX UI interface, focused specifically on older adults. I wanted to know first, do you know if there are any current standards to drive that design to make it user-friendly for older adults? And then second, what is AARP doing from a policy standpoint to drive that? For example, the FDA has user requirements for if you're developing a solution that's focused on consumers. I don't think that's specifically focused or optimized for older adults, but unless you can meet those requirements, you can't get the FDA approval to sell your product, your medical product, for consumer use, because it has to be simple. So given that we have some of those standards in place, how do those need to change when taking into account older adults?
So there are a lot of different parts to your question.
Yes, sorry.
But I will take at least part of it. I'm not aware of any generalized standards that are existing out there. I know that there are lots of advocacy organizations that kind of have checklists and suggestions in this area, but I don't know of any kind of particular national standard or anything like that. There are the requirements for some consumer insights into these things, but you're saying that the particular ones with respect to older adults, because they are specific to older adults, is not being represented. I would totally agree with you. From a policy perspective, we're advocating in numerous different ways to try to incorporate older adults in approval processes and in advisory committees with different federal government agencies. But I don't know of any and actually I should go look at it to start seeing that if we could do this in a systemic kind of way.
Yeah, and a follow-up question to that, because most of the people in the room are technical or engineers or the designers. If we wanted to start taking in the feedback from some of the presentations today and incorporating older adults into the design and usability features, what are some resources we can go to find those, whether it's a standard or an organization that provides access to older adults where you can do consumer focus groups, or I feel like the answer to that is AARP, but.
Yeah, so AARP obviously is a very good one, and you've got me at least as the initial contact, but we can arrange that through the Age Tech Collaborative and other ways. But AARP is not the only one, right? There is, every community has their area agency on aging. And so there are lots of people ready, willing, and able to engage from that perspective. But I was just talking to Jim Furman. We were talking about the Leadership Council of Aging organizations. There are 72 national organizations who primarily focus on the well-being of older adults. I would think that, you know, establishing and helping find that you can find them in many different places in your community, even if it's through church groups, for example. You know, simply asking goes a long way in constructing a positive feedback source. But AARP would be very happy to, if any of you have specific suggestions, we'll sloc@aarp.org. Happy to connect with you all.
Next question. Yes.
I just had a question with your 38 million members. What is AARP doing to kind of push out education and information about AI to kind of bring up some of these issues about trust and how should people be thinking about AI as part of their lives going forward?
So I say there are three ways. One is through our publications. We spend a lot of time and information because older adults are very interested in all of this. So AARP, the magazine and the bulletin, we actually have the largest circulating publication on earth. And so we put a lot of information in those publications. AARP.org is our online presence. And so we talk quite a bit about these issues online because a lot of older adults are concerned with things like privacy and trust and identity theft and the potential. This is a constant conversation older adults are having as they're paying attention to AI. The second way is AARP just had an enormous presence at the Consumer Electronics Show, in which we were showcasing 18 tech companies that came out of the AARP Age Tech Collaborative, in which we were sharing what those solutions were. There were some that used AI. Some used AI and didn't even realize they were using AI in the concepts of how they were delivering their technology and solutions. So communication tools, equipment, a variety of the technologies that are out there were profiled at CES, and we were talking about, in fact, the enormous potential. And I'm going to cheat and just give you some idea because the numbers don't come naturally to me. It is an enormous market out there. And there is this assumption that older adults are not tech savvy and that they don't use technology. I think that you all are in this room because you know that's not the case. And you know that you can develop solutions. But after doing the research, there's an $8 trillion US market opportunity. And so one of the reasons we are at CES is to encourage additional solutions to deliver on that. Adults 50 plus are 47% of the US population and have an economic power of $8.3 trillion in economic activity every year. So we're doing a lot of research in the space, trying to match older adults with the technologies that are out there, and then trying to improve these technologies so they meet older adults population. And I will tell you that we're really beginning to narrow the gap of the 50 plus between who is owning technological solutions versus younger consumers. Just to give one example, the smartphone. People 50 plus are 86% of the people 50 plus have a smartphone, whereas the ages 18 to 49, it's 91%. So it's a really shockingly large number of people. And then we got it for all different kinds of technologies. Probably though, one of the most surprising things is that the biggest difference is in wearables. Younger people tend to use the wearables, whereas only about 28% of older adults 50 plus are using wearables.
I wonder if that's because the wearables are relatively recent compared to smartphones.
Well, and is it easy to see?
That's true. That is a big
Is it
part of
easy to use?
Yes. Let me just see who else has questions.
So AARP is an amazing organization that's advocating for older adults with this very unique policy perspective. And so I'm on the academic side of the world. My name is Robin Brewer. I'm a professor at the University of Michigan, and I'm not on the policy side whatsoever. So what advice do you have for people like me who are building these technologies to better incorporate policy or impact policy in the design process?
Well, you heard those questions I kind of laid out for you. But what I would say, there are a couple of other principles that you may want to be thinking about. And part of it is, how are you going to be transparent, and how are you going to instill trust? And then how are you going to be providing transparency in which algorithms and how they are being used? Being sort of understanding, providing the background and being transparent in the sources of information used in your technologies. Being, thinking about bias and fairness, thinking about data privacy and security, thinking about accountability and responsibility, and cultural and social acceptance. So if you're thinking about from the perspective of how you would encourage this more globally beyond your own personal development of your solutions or technology, but you're more interested in thinking about how it will be globally done, if you go and you speak about these fundamental elements of trust and bias and data privacy and accountability and responsibility, showing that those are principles that are embedded in the things that you're developing, then you're going to be setting the standards for everyone else. And so leading by personal example is one thing, but also if there are opportunities within an academic setting or within a political setting in your communities to be talking about these elements, either from a regulatory perspective or from showing in settings when people are questioning your products and services, how you're meeting them, I would say you would go a long way in developing and creating the world we want to see.
I have a quick question. So you mentioned the market for as a whole for older adults, and I'm curious of that. A number of projects are involved in early prediction, right? Early detection of cognitive decline 5, 10, 15 years before it occurs. What's your sense of I don't know if you've done any surveys on that front, like the market for that and acceptability. Are people willing to do testing at their 50s, or, starting then and maybe relatively frequently to predict these?
So we actually have done research about that, but not specifically asking the question about the tool that's used to detect these things. We haven't, that I'm aware of, done any research asking, would it be acceptable for you to use AI? What we ask is, do you want to be tested? Do you want to be evaluated? And the answer is that they're most comfortable in a setting, in a healthcare setting where they trust their healthcare providers, right? And if there is some indication from their healthcare provider that it would be a good idea, then they're going to be much more willing to do it. But what they're interested in is understanding a baseline. It's not that they want to be tested regularly for whether or not they have cognitive impairment, but they want to understand, what is it that's normal? Are they experiencing something that is different from normal cognitive aging? And if it was part of a regular system of evaluation where people would get a checkup for their cognition, however that test is defined, in such a way that it was the same as getting your blood pressure, older adults wouldn't have a problem with that. And in fact, see the value in these kinds of assessments consistently over their lifetime. But if you kind of threaten them at the moment and you stigmatize what you're asking, and instead you're looking for, are you diseased? Are you abnormal? And that is something that they would be required to do, then there's going to be resistance. But it's like in most things in life, if the approach is it part of the regular analysis and evaluation? Not only are they willing, they want to, and they're eager to learn how it could be done in such a way so that they could get signs. And they're actually quite interested in knowing what they could do. One of the reasons that we founded the Global Council on Brain Health is that the ability to stay sharp as people age is as important an issue to older adults as the future of Medicare and the future of Social Security. But they didn't know what would be effective and if there were things that were effective. And so the Global Council was set out to sort of take the evidence behind what we know works and what doesn't, so that we could provide that information. So if you marry detection of patterns over time, which what could be better than AI and understanding what these longitudinal patterns are, and evaluate that and pair that with what are the affirmative things you can do to reduce your risks, then adults are clamoring for such a solution.
Yes, you have the.
Hi, Sarah. My name is Rob Blatt. I'm with Envoy at Home. You brought up a few interesting themes today around the shortage of caregivers, the aging population, and even consumer electronics. And what I see is that there's this symbiotic relationship between caregivers and the older adults that they're generally caring for. You know, we like to think that, caregivers, people who have dementia, it's not a part-time disease, so why do they have part-time care? And there's an enormous gap in how we support our loved ones and our older adults today. So with that backdrop, and particularly the backdrop around CES and innovation and a lot of the innovation that we talk about here, are there any obvious gaps or obvious misses that the industry is just not addressing from the purposes of serving older adults and even the caregivers who perhaps are giving up a sense of agency in their lives because they have an outsized influence in terms of a lot of the decisions made on behalf of older adults. So I'm just wanted to get your perspective around that and some of the innovation and solutions that perhaps there may be some opportunities that haven't been addressed so far.
Mm-hmm. Thanks, Ron. I think that could be a really fascinating conversation for several hours' time, but taking a crack at it, one of the things that I noticed about some of these solutions is they tend to think that the older adult is one way and that the caregiver is one way. And there's a lot in the middle where a person who has a cognitive impairment is not consistently incapable of making decisions, and they're not incapable of making decisions, say, around making choices about where they want their finances to go. But some of the solutions are out there are very one-note Johnny and give decision-making capacity immediately to the caregiver, rather than having more of a nuanced relationship between maintaining the independence of the older adult and what the caregiver and when the caregiver needs to step in. So finding solutions that can try to address this middle ground or change as the circumstances with the older adult changes, and having some flexibility in the system would be a tremendously valuable innovation.
Yes.
Hi, Chair. First of all, kudos to AARP for all you're doing to stimulate innovation in the space. It's really terrific. Could you just tell us about some of the AI-driven companies or products that you're particularly excited about that AARP is helping to incubate?
Thank you for that question. One of the ones that I wanted to talk to you about was RAS Mobility. And it simplifies calling by having a one-touch dial with photographs. And some of the interfaces are simple, and a caregiver can address some of the changes that need to be made on the phone remotely. So you don't actually have to be living in the physical place in order to change some of the settings on the phone. So for example, if you start to notice that the phone is getting lots of crank calls or fraudulent calls or sales, you can start to adjust and block different numbers that are coming in. So RAS Mobility is particularly interesting because it's very simple and it's designed with the person who's got cognitive impairment in mind, because all of the features are designed to make it simple and intuitive for somebody who may not need, both from a sight perspective, but also as a logic perspective, what are the steps a person has to follow if you can just simply hit the picture. So it's an integrated system starting to address some of the changes that a person has over time when you've got cognitive impairment. Let's see, I wanted to give another example. This one. That's the only one that comes to mind immediately. But there are all kinds of cool things. Actually, this is another question, another solution. If somebody can come up with, there was another speaker who talked about the frustration of the remotes, an integrated system that is actually simple to use. If we could take some of the interface that RAS Mobility uses to get the TV to be the stations with a one-touch thing instead of 3 remotes and figuring that out, that would be, you'd become an instant gazillionaire.
There you go.
So actually going back to the question before this on caregivers, and I think the point you made is actually quite important, which is this interaction between the caregiver and the individual, and the change in time for the individual's, cognitive status, and having products that understand that, so that you're not like, as you say, either or, taking over the caregiver's job or taking over the individual's. It seems to me that caregiver education then is extremely important, right? Because they don't know what they don't know. And so with respect to AARP, would it make sense then for AARP to reach out to the under 50s? Because if the caregiver were in the pre-50 age group, and now having confronted with these decisions, it seemed, caregiver preparation, if you will,
it seems to me perhaps quite important. I mean, is that something that the association is considered in?
So I couldn't agree with you more. Caregiver preparation is incredibly important. We have a huge initiative around trying to support caregivers. We've got policy and legislation, CARE Acts, and a whole variety of ways we're trying to support caregivers to make that a better situation. But I do think, to your point, AI has a tremendous opportunity to help and train caregivers. One of the most frustrating things for caregivers is, especially dealing with people who have cognitive impairments, is this idea that the person's doing something deliberately, right? And it's become so frustrating for the caregiver who's trying to hurry or do whatever they're trying to do or get done, and have these behavioral and emotional issues that are causing such great challenges and difficulties between the person who you're trying to care. So training the caregiver is at the center of serving the needs of the older adult. But what I want to tell you is that ARP is an organization that's designed for people 50 and older. You don't have to be of any particular age, however, to join ARP. And what's interesting is that the typical caregiver is a woman in her mid-50s who's already eligible for AARP. And we're spending a lot of time talking about the different generational changes that are associated with aging, that you think of an 80-year-old aunt or mother that you're taking care of, but lots of times they're younger onset disabilities associated with aging. And in fact, our whole caregiving program is more associated with general caregiving. And you could be a spouse, you could be yourself, an 80-year-old trying to take care of an 80-year-old. The millennials are the generation that are stepping up, and there are huge swaths of multi-generational caregivers. And training someone who is 20 versus 50 versus 80 to provide good care for their loved one, an AI solution that actually spans the differences. We're not just talking about serving the needs of older adults as the recipients of care, but to your point, as caregivers. That's who's spending the money, frankly, right? The caregivers are the ones who are really putting out the financial wherewithal to help themselves take care of their loved ones. And so I think you're onto something when you're focused on trying to meet the needs of the caregivers. And of course, agree with you, ARP should continue to do this.
Hey there, my name is Hannah Cowley. I am a Master's of Public Health student here at Bloomberg and also a data scientist at the Applied Physics Laboratory for Hopkins. Thank you for a great talk and a great conversation. My question, you're starting to skirt around it a little bit, but as I was thinking about a lot of the ethical problems and also your talk, I was thinking about the fact that we're talking about caregivers kind of as a monolith, and that older adults and people with cognitive decline are a monolith, which of course is not true, as we've seen from our ethical conversations. And then furthermore, older adults can be caregivers in and of themselves. Absolutely. And also have problems. So I was wondering if you had any thoughts on kind of the intersectionality and the diversity of people that exist in these caregiving and then also in need buckets.
So thank you for that question, because that was the point I was trying to get out at the beginning. You're trying to deliver for humanity, which is incredibly diverse. So unless you're thinking about the economic differences, unless you're thinking about these social differences, then you're never going to meet these different needs of people. But the principles of universal design, whether you're talking about it building a building or you're creating AI, you have to look at the same fundamental principles of access, soundness, and cultural and social contexts in order to deliver these successful solutions. And so thinking about it from the perspective of, would my Aunt Sally be able to use that? Would my friend down the street, who's totally different from me, would his Uncle Albert be able to use that? But the only way you're really going to get at it is if you get Uncle Albert at the table and Aunt Sally at the table amongst this and really have them part of the solution. And so fundamentally, having these conversations on a regular basis and getting the input of the people you're trying to serve is going to get you the solutions that will work.
Hi, great presentation. This kind of builds off that last question. Regarding to market research, when I think about the risk profile for a lot of aging issues, a lot of it arises in places like inner cities or the Southern Belt and places where it's hard to get access. And a lot of the people that are seeking care options often are coming from a place of privilege because they have the option, to listen to the Huberman podcast or whatever it may be to take control of their health. And I was curious, what's AARP's strategy in getting in touch and surveying the population, like in the Southern Belt, East Baltimore, Ward 7 and 8 of DC, getting that perspective? I'm curious, what's the strategy there?
So you ask a really great question, because it's not just the typical divides in our communities and our societies that you have to go for. You have to look at the differences between rural and urban, and policy and politics as well, just like you're looking at the economic and social differences. So one of the ways that AARP is addressing that is we try to go local with respect to everything that we do. We have 53 state offices, right? And we are a nationwide organization, but you have to get at the local level to understand fundamental choices that people are making. So I give this example. We're working on policy around women's breast health issues. And when you are trying to create a solution for somebody in rural South Dakota, people make decisions about what healthcare they're going to receive and when they're going to receive it, because getting to the health system in rural South Dakota means the only practical solution is a radical mastectomy, because they can't get back and forth to chemo and to radiation therapies. And so people make drastically different choices. And obviously you know this because you were pointing out the question, but geographic differences make absolutely critical decisions, as does age and gender, but cultural beliefs as well. I think one of the speakers told the difference between the FAIR and the CARE standards. And when you're making those standards and you've got values like community values versus independent values, and you're juxtaposing those, it's only by going and getting the input of those rural communities and hearing and understanding that when you're making policy decisions, for example, the life expectancy of Native Americans are such that they are unlikely ever to meet the age of Medicare eligibility, because they're going to die before the age of 65. So until you have heard and understood the values of the people you're trying to serve, you're not going to know. And so having that local approach and understanding it from a variety of places and making sure you're getting diverse input is absolutely critical.
And I just have a follow-on question, which is, as an AI-focused initiative, we think a lot about data, right? And given the diversity, in the problems, and a lot of these data sets are not necessarily available in hospitals, right? Because they happen in the natural living environment. So what we need as a whole is a huge, huge amount of data if you really want the AI to deal with the bias issues and to work for people, whether they're living in urban or rural environments, and the backgrounds. I think it's just, the data challenge is enormous as well. I don't know I don't know that there's a solution, but I'm just curious if you think about those kinds of issues.
So I think it's a great solution. The strength and the weakness of AI is the same thing: garbage in, garbage out, right? So the potential to collect and the inspiration to make sure that the data collection is workable is critical. And so back to your point, being at the table to have the conversations about arguing that must be inclusive, not just only in your own environment, but those people who are collecting the data and those people who are funding the data. If you're asking those questions of those people, then you're going to make sure that what you're going to develop is going to meet the needs that eventually you're trying to design for.
Great. I think we're at time now. So I wanted to thank Sarah. This has been a fantastic conversation, very thought-provoking. So thank you.
Thank you.